Time for another morning conversation this morning with Dr. Isaac Bogoch, infectious diseases specialist at Toronto General Hospital. Good to see you back, Dr. Bogoch. Thanks again for the time this morning. I want to start here. The recent deaths of not only 6 children in Ontario, but 4 also in British Columbia, all from a bacterial infection grabbing parents' attention. Of course, we're talking Strep A. What do we need to know about this illness, and why is this happening now?
Yeah, awful to hear. Yeah, absolutely awful to hear about these devastating cases. This is Group A Streptococcus. Group A Streptococcus is a very common bacterial infection, especially in children. And many parents know this infection well because regular Group A Streptococcus can cause strep throat, can cause a skin or soft tissue infection. They're typically uncomfortable, but easy to diagnose and easy to treat. And in fact, I'm sure many people listening have either had this before or their children have had this before. What's unique in this situation is rarely Group A Streptococcus can be invasive, meaning it gets into deeper tissues, it gets into the bloodstream, and that can cause a very, very severe infection. People get very sick very quickly, and it's important that they seek urgent medical care so that they can go on the appropriate antibiotics and make a full recovery. However, if there are delays in care or if there's overwhelming infection, you can have these devastating side effects. It's not entirely clear why this is happening now. We certainly know that invasive Group A Streptococcus is a little bit more common following viral illnesses. And of course, our winter has been punctuated by a large COVID wave, influenza, RSV, and other infections. So that might be the cause, but I still think it's not entirely clear just yet.
Okay, appreciate that perspective. Let's move internationally right now. And I know this is right in your wheelhouse, Dr. Bogoch. Cameroon starting the world's first malaria vaccination program for children. Let's talk about that.
Huge deal. Absolutely huge deal. So we're in the era where malaria is going to be transformed from an infection that kills hundreds and hundreds of thousands of children per year to one where hopefully it's more of a nuisance. We'll see. This is the beginning of something big. Vaccines for malaria are available. What they do is they reduce the risk of severe malaria cases. And many countries are starting to roll out this vaccine. The really interesting component of this is that the vaccine that's being used is pretty good in the sense that there's lots of doses and you likely need updated doses on a regular basis. But all the data to date shows that it significantly reduces pediatric mortality from malaria. And again, there are hundreds and hundreds of thousands of deaths per year of kids under the age of 5. And this will go a long way. What else is really interesting is you look at what's coming through the pipeline. There's updated malaria vaccines that may even provide even better protection. And hopefully in our lifetime, malaria deaths will be a thing of the past.
Wow, to think about the lives that can be saved from that. That is pretty remarkable, Dr. Bogoch. All right, in the meantime, this is something that was really percolating more last week, but we didn't get to talk to you last week, so I wanted to bring it up anyway. X, Twitter, buzzing about tweets about Disease X, which, to be clear, is not referring to the content of the social media site, but rather it's a placeholder for the future pandemic discussed at the World Economic Forum. For conspiracy theorists, you've got pandemic, check, World Economic Forum, check. But Dr. Bogoch, help us tackle the X factor here. Is this evidence of responsible public health planning, or is it something more alarming?
No, this is, I like how you framed it. This is perfect for conspiracy theorists, but just so everyone's clear, Disease X is just a placeholder. It's just a name that we've given long before COVID-19 for any infection that has epidemic or pandemic potential. And whenever we talk about Disease X, we say, okay, how can we better take steps to prevent, respond, and identify infections of epidemic and pandemic potential? Of course, we don't know what those infections are. We have a clue. We know that there's, coronaviruses that have this potential. We know that there's influenza viruses that have this potential. But are there other, viruses in nature that could spill over into humans and cause this? So we just use the term Disease X as a placeholder name. That's it. Nothing else to it.
Seems to apply to Twitter as well these days. Okay, in the meantime, Dr. Bogoch, always good to have a conversation with you. Thanks so much.